this training is being introduced by Ministry of Health and Family Welfare in collaboration with other ministries and partners like WHO, UNICEF, and with the support of National Center for Disease Control. And the intent of this training is that how do we reduce the exposure to transmission of range of illness associated with novel coronavirus disease. With the cases rising, Ministry of Health in collaboration with all the partners are seeking support, and we as a community, we have a role to play. So as Ayush doctors, practitioners, and you will be training Ayush students and field workers in the field, you will be cascading this training so these colleagues or Ayush students and field workers can be trained well. So through this training today, we will be able to make sure that we are communicating on role of the Ayush student, what they need to do in the field very clearly, and what role they will play when they are supporting interventions at the district level. Second, how they are, what information they are communicating to the areas they will be working in, and especially related to information, as Dr. Tanzin has also talked about, what are the prevention, what are the control measures. If we are looking at social distancing, we are looking at issues related to home quarantine, etc., all that will also come in. Third thing is the major role where government is seeking support is on the community surveillance and contact tracing. So when you are training in a cascade mode to IU students and field workers, this through this section, they will be informed in detail how the contact tracing, how the early identification, early reporting of the large clusters will be done. Next slide, please, Varsha. We will also talk or learn in this training about stigma and discrimination. There are, you have access to information, what you are seeing it in your areas right now. There are high prevalent of myths and misconceptions related to coronavirus disease and fears related to it. So we will be learning about it in this section, how we can address those myths and misconceptions. Our fifth point would be, our fifth section is about how we will be connecting public health services at the community and household level. Our students and field workers will be helping the communities and households about how home quarantine, home care, psychosocial care can be addressed or linked at their level. Last and the most important thing is that when they are in the field, how they will take care about themselves, especially when they are engaging with the suspected or like patients where there could be large clusters, etc. Next slide, please. Varsha, can you do the next slide, please?
I'm sorry, the next slide will be of the next speaker.
Okay. I thought like we will be taking through what we have. Okay, so now after this, we would like to invite Dr. Vidyarthi, who will be taking us through what exactly the role of the IU student and the field worker will be in the when they will be called by the district collector or by the district medical officer. What would be their role? Thank you.